First question is, what if one of the simplest interventions we can implement for dementia care is not a drug, but a song? Music really has the power to change the behavior of a person with dementia towards feelings that are positive and cooperation as well. So today I'd like to present about the practical use of music for daily caring of dementia, the music therapy evidence. As mentioned, my name is Leonardo. I'm a PhD student at the Cambridge Institute for Music Therapy Research. Jörg Fagner and Alex Street are my supervisors on the sleep music for carers. I do want to emphasize the fact that in 2021, CIMTR, so that's the acronym, won the Queen's Anniversary Prize for Music Therapy Research in Dementia. So to start off, the power of music in dementia. You are familiar that most people with dementia regularly experience anxiety, depression, agitation, cognitive challenges, and sleep disruptions. And there are many ways to tackle this. Cognitive stimulation therapy was a very interesting one, and reminiscence. But music therapy has robustly shown that it improves these aspects, reducing anxiety and depression, reducing agitation, improving cognition, and also there's early stage research about better sleep quality in people with dementia thanks to music. So how does it work? Why would music work? So music is a multi-sensory non-verbal communication. Here you have a diagram about all the elements that are contributing to a group music therapy. So with the music, the characteristics of the music, you get to interact with the people around you, either because you're playing an instrument, because you're dancing, because you're singing. You might start laughing, smiling, even talking. And all of these are creating a social feedback loop. But it doesn't stop just to the social aspect. It also gives a sense of self, a sense of agency to the person with dementia, because you get that one-to-one interaction, or you decide to either take forward a one-to-one interaction, or you have a one-to-one interaction thanks to the therapist or the staff. So there are three aspects identified that music therapy targets. So at the individual level, it meets unmet needs. So what does this mean? For instance, a music therapist or trained staff member could react musically to behavioral responses. In the neuroscience realm, it regulates the autonomic nervous system. And so you might have heard fight or flight or rest and digest. That's this nervous system. Then that's the autonomic nervous system. Wide brain stimulation of the preserved brain networks as well, thanks to music. In the interpersonal realm, it restores and enhances communication, cooperation, and trust between the person with dementia, staff members, family, and music therapist. And at the institutional level, you can reduce escalation of, agitation, for instance. It also supports a non-pharmacological culture, and it can be a low-cost intervention, depending on how much you want to invest to improve it, to incorporate music therapy. So just quickly, because I mentioned a bit of the neuroscience, this is a diagram looking at all the brain and nervous systems affected by music. So I mentioned the autonomic system is this red line. Then any movements relating to the motor cortexes. So when you're dancing, for instance, and then obviously acoustic aspects, because it is music and it's audio. This is an interesting one because we were just looking earlier at cognitive stimulation and reminiscence, because social cognition, music perception, and the regions affected by frontotemporal dementia were compared in this study. And you see a lot of, there's overlap. So there's a reason that it's useful. There's a neuroscience reason that music helps. Now, what does music therapy mean in practice? There are three categories of music therapy. The active music therapy is where you're singing, you're playing an instrument, you're moving to rhythm. And this is very cognitively stimulating. It's been shown to improve quality of life. And it's usually led by a therapist, a music therapist. So that's active music therapy or rhythmic music therapist, although it can be done with trained staff. Receptive music therapy. So you're listening, but you're guided by the therapist towards relaxation, for instance. And so therapist or trained carer, you can reduce anxiety and depression with that. That has been shown. Or music medicine, which is playing recorded playlists. This can be delivered by anyone, and it's been shown to improve all the markers I shown initially. Now, this this has been shown as effective dosage of music therapy. So it's with a music therapist, and it's mainly active music therapy, this research, but it's a minimum of 12 weeks of about 1 or 2 sessions per week, which can be 30 to 60 minutes each, because you'll want to reach at least 8 hours total exposure. And then you will robustly affect all these outcomes mentioned. There are some large international studies, or this is a national study, that were done at CIMTR that have incorporated music therapy in an inpatient ward hospital setting or in the home-based care setting, so training the carers to deliver music, or in a community setting. This was in a concert hall where the group would meet regularly. So I will give you a 24-hour music map that you can use. This is just a formal one. I'm going to give you an easy to read in a second. So this is just with the evidence. So 24-hour music map. This is what the science is suggesting that works. When the person with dementia wakes up, music can be used to sing or create some rhythmic movements when they're, already kind of alert. This can be led by the therapist, carer, or staff, and it's important to use familiar music. So that's the familiarity is very important, as we know, with reminiscence therapy, for instance. And so you can incorporate instructions into the lyrics that you're singing, for instance. Then when you're bathing or any personal care, playing calming music has been shown to help with this procedure. Again, you can sing simple instructions instead of speaking them. Dressing and grooming, the same, but here's familiar, upbeat playlist. So it's based on musical taste, personal history of the person with dementia, what they like to listen to. And again, incorporate instructions into the lyrics. Put your shoes on. That could be a way. In Mealtimes, it's been shown to help with reducing agitation, and calm instrumental music, before seating and during seating, kind of sets the context if it's used regularly for eating. Avoid upbeat music because, muscular movement will want to go at the pace of the music. And early mid-afternoon here, but also in the late morning or in the morning when person with dementia is cognitively stimulated, you can use the active music sessions, 30 to 60 minutes, in group settings or one-on-one with a music therapist or trained staff. To prevent sundowning, it's been suggested to play the calm playlist, calm personalized playlist. If it's a noisy environment, consider headphones. And then it's all calm music down. So also going in line with dimming the lighting, reducing the noise, and playing calm playlist while falling asleep. And obviously the routine is important to help. Sleep routine is very important. Avoid stimulating lyrics if possible. So just to iterate for the music playlists, it's an iterative process. So what does it mean? Use music that's time or goal appropriate, then observe how the person with dementia is responding to those, and replace any unhelpful music with, again, personal tastes, and that is appropriate to the moment. So there has been research, a HOMESIDE study that has trained carers to implement music. So this was the the way that did it, 2-hour trainings 3 times, weekly practice, and they learned singing, rhythmic movements, playlist curation. The control group had an emotional reading because it was an international randomized control trial. Caregiver burden is reduced, and neuropsychiatric scores also were reduced. Note that a UK music therapist holds at least a 2-year master's and is HCPC registered. So that's something to consider when you're implementing. And finally, if you want to incorporate music therapy at your institutional system level, you want to incorporate the music therapist into the multidimensional team meetings and care plans for the patients. So to discuss with the other therapists, the doctors, nurses, and other staff members. You can know staff that there are moments where music helps and moments when it does not. Again, communication between therapist, staff, and family is very important, so it's important to plan that in. And recognize that music is actually a essential clinical communication, not just entertainment. So if words fail, let music speak. Today, on this week, you can test one of the routines, whether it's the bedtime, sleeping, create a playlist, calming for that case, and you can use a metric. I'm not sure if you're familiar with these, but this is the agitation inventory, depression scale, cognitive testing, etc. But just to see the improvements. So choose music if words fail. So thank you very much. Hopefully that was of use, and happy to answer any questions.